from MTN, the Montana Television Network. This is Face the State.
Thanks for joining us this morning on Face the State. I'm Dennis Bragg, and we're joined by Dr. Reed Humphrey, who's the head of UM Health Medicine and has a bunch of other titles as well, including College of Professional and Biomedical Sciences, and of course involvement as well with family medicine residency in Western Montana too.
Right.
So Reed, thanks for coming on. Appreciate you being here with us.
It's my pleasure to be here, Dennis.
Yeah, we're going to dive into kind of a topic that we all know happens at the University of Montana. Maybe we know somebody that's involved in the program and those kind of things, but we don't understand how overarching and broad this program really is. And we also want to talk a little bit today too about the growing field of healthcare, especially here in Montana, and kind of give some advice maybe to some of the parents out there or some of the students that are thinking about a career in medicine, because it's definitely growing. Let's talk a little bit about your background and your involvement with UM and what brought you initially to UM, and tell us a little bit about what you've done there.
Yeah, so actually I passed through Missoula when I was 23 after I finished my first master's degree at Wake Forest, North Carolina. I'm originally from Pittsburgh, and I had the presence of mind to keep a journal, and in my journal I made a note that Missoula, Montana, cool town, could live here. And it took several decades to get me back here, but so my academic career took me through the Medical College of Virginia and working at the VA Medical Center there in heart failure transplant. I'm a physical therapist. My PhD is in applied physiology, so I studied them. And then, but my career in PT brought me to Missoula in 2006 as chair of the physical therapy program at UM. And I did that for 8 years. And then my predecessor, Dave Forbes, who was the dean of the college, retired, and I put my hat in the ring, and you know, I was the last man standing, or last person standing, I guess. And so I just finished my 5th year as dean of the college, which has been growing and continues to grow with academic realignment at UM.
Yeah, I was going to say this must be an exciting time with a lot of the new focus on technology and on the sciences and all those kind of things. Kind of that realignment is really, I know, re-energizing, especially School of Medicine.
Yeah, it's been really a fortuitous realignment for the college. So my college originally was a school of pharmacy, and then it became a school of pharmacy and allied health, where they added physical therapy and then social work. We've added, since then we've added a School of Public and Community Health Sciences, which is growing really rapidly, especially in the area of population and preventive health. So we still have the Sky School of Pharmacy, of course, with a pretty big research component to that as well. But with the academic realignment this year, I gained the School of Speech, Language, and Hearing Sciences, and we're going to be adding occupational therapy by 2021, because there's a huge demand for occupational therapists in Montana and the region, a really underserved area. And also picked up the Department of Health and Human Performance, which I love because that's really where I grew up.
Sure.
In exercise physiology and applied physiology and athletic training. So it's sort of now bringing a lot of the health programs under one roof, which is so important because the changes in healthcare are driving interprofessional collaborative practice. So really, truly team-based care where PTs and OTs and speech language pathologists and athletic trainers are all really working together, not just in an interdisciplinary fashion, but really working together to improve the outcomes for patients. And that's what the healthcare providers want and need. So it's been cool.
It's exciting to see that too, because I know President Bodner, that's the one thing he's talked about, is that, you know, a lot of times universities have developed in such a way that, you know, you had this discipline, that discipline, and yes, there was some of that interdisciplinary functioning. But now looking at, well, what's the end result of that? What do we need in the outside world? And we're finding that, aren't we, especially with medicine, that there is that interoperability, if you will. It really is a
you know what's been really, and fortuitously, you know, about 5 years ago or so, we established the Family Medical Residency for Western Montana. And so the University of Montana sponsors that program in collaboration with St. Pat's Community and Kalispell Regional. And then Partnership Health Center here and Flathead Center in the up near Kalispell. And we're training, we graduate 10 residents per year, and over 70% of them are staying in Montana as primary care rural physicians. So that was a singularly good addition to Western Montana. and a real benefit because we're really sort of helping incrementally solve rural healthcare issues. But for me and for my college, it's been really fortuitous in the sense that they're now part of our interdisciplinary team, an interprofessional team. So we have their faculty are working with our faculty and our students. So now we're drawing the physicians in to work alongside the pharmacists and the PTs, and actually the departments that are not in my college. It's like the Department of Psychology. So we have a relationship with psychology, and also MSU College of Nursing, which of course has presence on our campus. So we're all learning in team-based care, and we just were approved by the Board of Regents to establish an MUS Institute for Interprofessional Education and Collaborative Practice, which is really going to allow us to be, the really key health education institution, between Seattle, Salt Lake, and Mayo Clinic.
That's amazing.
Yeah, it is. It's really a cool time to be doing this because there's such a demand.
That's exciting about that 70% though on the doctors, because I know going into that program, we've been dealing with this. It was only getting worse. How do you find and train professionals that want to stay here, practice, and be a part, especially at the rural hospitals?
Yeah.
So that's exciting to see.
It's the commitment for the university to serve the people of Montana, and the opportunity to do rural care and do underserved care has allowed us to really be more impactful in that regard. So we're up in the Flathead, and we're down the Bitterroot with our iFarm programs, doing screenings and so forth. But to be able to get practitioners into rural areas has always been a challenge. Part of it is, when you're a solo practitioner, whether you're a physician or a physical therapist or a social worker, it's tough to be a solo practitioner because you're taking care of everything and you don't have that team around you. So we're really focused on building that on that team-based approach, and it's an exciting time. There's a tremendous demand, and I'm really optimistic that we're meeting that demand. I guess from the residency perspective, we're also able to recruit residents who have a commitment to rural care. So they're not going to be trained here and then just run off to a specialty somewhere in an urban center. So we're pretty selective.
That's exciting
helpful
too, because so many of the hospitals, I think of the ones I've seen, even just here in Western Montana, adding new technology, adding things. I mean, they're really on par, but you need those professionals to come in and be able to use that equipment and that tech and those new procedures too.
Right. So that is another element to what we're doing. I think I think most people, appropriately so, would see the university as sort of that academic island that is training clinicians and sending them out and wishing them well. But several years ago, we developed Health and Medicine, which is sort of this overarching entity that pulls all the health programs together. And its mission is really twofold. One is to enrich that academic experience for our students and to recruit the best and brightest students, which is not problematic for us. Our biggest challenge is we leave a lot of kids at the doorstep because there's such a demand in the health professions, right? But it's allowed us to focus inwardly on our students, but then also to develop external partnerships. So we work closely with St. Pat's and Community and Partnership Health Center, Billings Clinic, and others to help identify what do they need from the university, not just in education, but in technology and innovation. And those partnerships are going to help recruit better caregivers to Western Montana, whether they're therapists or physicians or nurses, and help retain them. And I think that's when you think about the mission of the university and its partnership with its citizenry, that's where we're really able to make a difference now.
And I know, and you alluded to this a minute ago, we were talking about how a lot of these functions, we move on and we'll focus on patient care. The idea that it just was when you went to the doctor years ago, it was like, here comes the guy in the white coat with the stethoscope and prescribes or does little things, we'll see in a few weeks. now there's so much more to healthcare when it comes to, like you say, physical therapy, occupational therapy, a lot of different things that are really focused on care of the patient. And that's really new and an exciting change that's taking place, isn't it?
Yeah, it's always, it's always been a bit siloed, right? So you went out, you saw the physician, then you went off and saw the physical therapist, you saw the occupational therapist. And in many respects, we still do that, but we're developing much stronger interconnections between the clinicians so that their plan of care is more effective, more cost-effective, better patient outcomes, better patient satisfaction, it's always where we've wanted to be, but healthcare, like a lot of things, can be a bit glacial, but the demand for health services, the increasing health problems in society, from behavioral issues to physical issues, is now outstripping our ability to manage in the old way.
Right.
The payers are recognizing that it's better to keep people out of the emergency room. Mm-hmm. And so the hospitals are focused on doing that through better, earlier intervention. So we're finally, I think, hitting our stride as a healthcare system to help patients get those better outcomes at lower cost. I mean, that's always been the goal. It's certainly been the goal for the last decade, but between the need for healthcare and the economic pressures, it's forcing us to really do the right thing, and that's good for everybody.
It's interesting to see too how employers and companies and businesses, who I've always thought of being sort of in the middle of that, I won't say tug of war, but in the middle of that balancing act, are now really starting to recognize how does wellness and how does that fit, and that's exciting that they now have more options to be able to help their people stay healthy and get the assistance they need, wherever it's at.
There was a time earlier in my career that and I think is still a challenge, is always a challenge, is when wellness, health and wellness is seen as a perk, more than an absolute necessity for an employer. And to be frank, we've always tried to work collaboratively with employers to develop better wellness programs. But I do think the advent of technology, the internet, which really challenges everyone to have good health consumerism, is rapidly making inroads in places where it was more glacial before. But there was a time when we could afford to take care of 15 or 20% of the population. But when that percentage increases disproportionately, you've got to get, as I like to say, if you spend all your time at the bottom of the stream pulling the bodies out, and you don't take time to go up and see who's pushing them in, then you're always going to be at the bottom of the stream.
Yeah, you got to get upstream.
We have to be upstream.
Yeah.
We have to be upstream with adults, and we have to be upstream with children to really truly prevent a lot of preventable illnesses from happening.
Let's talk a little bit about then what are some of the major degrees or different things, and maybe how is that changing? If I'm a student coming into UM, maybe I want to pursue a particular thing, what are some of those new things that are kind of emerging in terms of an actual degree or walking out the door knowing a particular skill set?
Good question. So I think what's been an interesting conundrum for UM, and for lots of institutions like UM that have had a major focus in liberal arts. It's interesting because there's been a downturn in students who engage the liberal arts degree. But in point of fact, your best job doesn't come at graduation at 4 years. If parents really are thinking about their kids having a productive career, especially in a health field, they're really looking at a 6 or 7 year progression. And it really starts with a strong undergraduate degree. And the best clinicians, the best scientists, are those who are critical thinkers who come through the liberal arts. So I think that we've got to make certain that we intentionally connect a good, robust undergraduate degree. So actually some of the things we're doing at UM right now, we started a interdisciplinary program in undergraduate neuroscience several years ago. So that brings faculty in from several different colleges, both behavioral as well as the metabolic side or cell side, and we marry them, and so the students can really see the broader perspective and impact that neuroscience has, and it really helps prepare them for that post-baccalaureate degree or path. And so one of the things that we're trying to do through UM Health and Medicine, of course, is engaging students as soon, even before they matriculate to UM, hopefully they come to UM, but once they're at UM, is to help them make good intentional decisions about career paths. Because one of the things that we have at UM, fortunately, is that we have upwards of 7 different clinics on campus,
right,
where we're from PT to speech to our clinical psychology center, and where we're training students in the presence of patients, faculty, staff, students, and others. They're not simulated, and getting those experiential opportunities as an undergraduate. So if you're a parent thinking about like your kid being a physician or a caregiver, you really want them to get good grades so they can get into that post-bac program.
Yeah.
But what you really want, or what you should want, is them to get good experiential opportunities as an undergraduate. So,
well, I would imagine in such a diverse world as we're in now with medicine, a lot of other industries, but if I'm a young person, I'm coming in, I may have an idea like, oh, I want to be this, or I've watched Grey's Anatomy, so by golly, I want to be, that person. But then the reality of it is they may get in and find out, I hadn't thought about physical therapy, or I hadn't thought about occupational therapy or technology in medicine. So I would imagine that would give them a chance to adjust and change and make the overall investment even a little better, right?
Your example about PT is a great one. It's, I was chair of PT for 8 years here, and had an academic career prior to that as well. And what's so interesting is that we have a lot of PT students, for example, that chose PT because they had an orthopedic injury, like an ACL reconstruction,
injury,
right?
Something like
and
that.
They went through rehab and they thought, well, this is really cool. This is what I'd like to do. And then they enrolled in undergraduate school here at UM, and they'll get experiential opportunities. They say, well, I'm going to work in the New Directions clinic. So we have a program on campus called New Directions, which is a medically supervised program for people who are mobility impaired. So people with stroke, with neuromuscular disease, paraplegia, and the like. So, and these are very compromised patients. And so the students, as freshmen or sophomores or juniors, are now working with these patients and seeing, whoa, PT's way bigger than just orthopedics. In fact, it's neurology, it's cardiopulmonary, working with, in my area, heart failure and transplant. And there's a lot, we see a lot of kids then shift, their focus. But that's good. That's good for them, and that's good for us.
President Bodner's always talking about that. He says, we're entering an era where you could change 3-4 times in the course of your career. So to have that kind of experience is really powerful.
Yeah, and getting the experience in undergraduate school, to be an intentional critical thinker and to really problem solve, that opens up so many doors. And so I just think it's just so important that as parents start thinking about and kids start thinking about like what's next after high school, that they don't lose sight of the fact that it's going to be important for them to move through undergraduate school, but with an eye beyond that, because there's not many occupations that are well served right at the point of graduation. So, it's the deeper perspective that really matters.
How about the Missoula College program? Because I know that a lot of times that's a front door for a lot of people to get that first taste of what healthcare may be. And how does that work in terms of being sort of that first taste of this?
Yeah, when Missoula College, which of course is part of the university, it's across the Clark Fork. But what a beautiful facility it is, and they have like 6 to 8 different health professions programs at the 2-year level, from respiratory therapy to surg tech to RN, and those are first of all those can be gratifying careers in and of themselves, but they also provide a progression for a student to move through Missoula College, and then, if they wish, matriculate onto the Mountain campus, and then go deeper into a profession. And I see Missoula College as, especially in its current format, as this gateway opportunity for kids. Not just in the health professions. We have our president of ASUM a couple years ago, who's now in law school. Came through Missoula College and for a lot of Montana kids, it's about finding their way.
Yeah.
And Missoula College
taking that little time to sort of adjust.
Yeah.
And figure out exactly what do I want to do with all these interests I developed.
And the addition of the new building, and by virtue of that, a much closer association with the Mountain campus is, I think, is really going to yield real dividends down the line. Well, I work really closely with the Department of Health Professions over there. They're part of UM Health and Medicine. They help steer what we're trying to do, and so building stacked credentials and pathways is front and center for us.
One thing I want to touch on, because I think a lot of us in Missoula in particular, we'll see families move in. And you got, here's a really nice family that's come here, maybe they're just a couple, or maybe they have a young one, and you'll ask them, you say, what brings you here? Well, we're only going to be here for a year or year and a half or two, or whatever it is. We're involved in the pharmacy, for example, program, or we're coming back for postgraduate degrees. Seems to me like that's a really interesting aspect of UM and the School of Medicine, but also that economic impact on the area. Are these people coming? And I know a lot of them have come here initially, moved here, and then said, I kind of like it, I'm going to stay in Montana. And so that's an interesting feeder program too as well.
Yeah, it is. When I was chair of PT, I often said that we admit like 36 pairs of Birkenstocks to UM every year, and they come from all over.
Yeah.
Right. But as a result, they get here and like, Missoula's pretty cool. I'm not leaving. And so we have this really robust, vibrant culture of physical therapists in this community, and other caregivers as well who move here. And as a result, we have some of the highest per capita, the highest number of PTs in the country. But that serves the population well, and it is an economic. It's certainly an economic driver, because all therapists, nurses, all the caregivers and physicians, of course, bring serious resources to Missoula, and so I think you look around Missoula right now and you see this $1 billion worth of building going on, and things that are really exciting.
Yeah.
I think, we shouldn't exit the conversation without talking. I want to come back just for a second to the undergraduate experience, because we have this incredible pre-medical sciences program on campus, and I think that's probably one of our under-advertised programs. But kids who are looking to be a physician can come to UM, enter into our pre-med. It's an intake major, right? Mm-hmm. But they get such good advising, and they have these experiential opportunities on campus. So as a result of good advising, really strong academic programs, and adding that experiential piece, we have our admission rate to medical school is like 20 points higher than any other program in the region. So the path to medical school, the path to medical school goes through Missoula.
It does, yes.
It does.
Yes.
But all of that really builds robust resources, both for the university
and the research component of that too is kind of exciting, because I know several people I know that came here, went through something especially healthcare related, and then said, and maybe they go out to Seattle, find out the cost of living is way worse. And they say, I'm going to come back and I'm going to open, some operation of some sorts. Mm-hmm. And so there's an interesting retention that maybe leaves briefly and comes back. And they come back, and it's really helping drive a lot of our science and technology and healthcare and everything that's going on here, especially in Western Montana, but in Eastern Montana as well.
Yeah, the university has developed a number of spin-off companies that are, in tech and in the pharmaceutical industry as well, and yeah, they're here and up and down the valley, quite frankly, so yeah, and it's also interesting that we'll have clinicians who graduate, and they will move to Seattle or Denver or somewhere, but they almost invariably come back. But that's good too. It's important for kids to get out.
It is. I want to touch on something here before we run out of time.
Sure.
We talk about because I remember for quite a few years we've talked about the graying of Montana and how there is going to be such a need. And I agree. You go back 10 years, we kept hearing this over and over. So I wanted to ask you, as we look at that, and from the standpoint of education, if somebody's looking to get in the field, are we seeing that growth develop? Are we seeing that demand develop for broadly healthcare services in Montana, kind of like we've anticipated for about the last 10, 15 years?
Yeah, we are rapidly aging, one of the most rapidly aging states, quite frankly. And we have a lot of individuals who retire and come back to Montana. So, as a result, the focus on gerontology has been a significant focus of the university. We have a Montana Geriatric Education Center that just got refunded, again, federally, so that helps train students in taking care of the elderly. The integrated behavioral health programs at the university and Department of Psychology are burgeoning, if you will, as it should. We've got, as we know, we have a mental, I don't need to remind anybody that we have a mental health crisis nationally, yes. and so significant in Montana, and the points of contact for patients as they age, but even at earlier ages, there need to be multiple points of contact, and so integrated behavioral health is allowing us, and again, work interprofessionally to help identify issues early and intervene early. But there's no question that we have to be prepared for an aging population, a lot of chronic disease, but finding ways, and it just really increases the need to keep them out of the emergency room, right? So being able to intervene through technology, being able to intervene in small groups in urgent care and other places. It's an all hands on deck
like you
issue.
say, intervene with people like me who are saying, well, I'm really not that old, and physical therapy, those kind of things could help out too. So it's a dynamic situation. It really is.
Yeah, remember, we invented time, Dennis.
Yes, that's right. Oh, that's right.
So we're the only ones that actually count years. So it's how it's not age is not chronological; it's physiological.
Yeah, that's exactly it. Yeah. Well, I appreciate it very much. Final question: sure. If somebody is interested in finding out more, if they're a student or maybe parents of students will be here shortly, how can they find out more about College of Medicine?
Well, the easiest way to connect to is through Health and Medicine. That was because when we developed that a couple of years ago, we developed that as a portal. I think before we did that, you had to do some forensics to figure out where things were. So really, if you go to umt.edu/UMHM, you'll get into the portal, and we have 55 degree programs, 7 clinics, multiple research centers. It's all in front of students and parents and others to engage.
I like that.
Yeah.
Well, it's exciting to have these kind of resources in play, especially here in Montana, and to see the progress we've made. And we appreciate you coming by.
I really appreciate
Give us
the
an
opportunity.
update. We'll invite you back to keep us posted and break it down even a little bit more sometimes.
That'd be awesome, Dennis. Thank you for the opportunity.
Right. Dr. Reed Humphrey with us, at the head of the Health and Medicine, of course, the College of Professional Biomedical Sciences. So, Reed, thanks for coming by. I appreciate this.
My pleasure, Dennis.
And thanks for joining us today on Face the State.
Thanks, everyone.
You've been watching Face the State, a presentation of MTN, the Montana Television Network.